presentation on exploding head syndrome. Muskan and I will be taking this forward. Before we move ahead, I'd like you to go through the topics that we will be covering today. That is the introduction to exploding head syndrome, the historical background, symptoms and experiences, prevalence and statistics, causes of EHS, the diagnostic criteria, prevention, treatment, and management. Moving ahead with the introduction, exploding head syndrome is a type of parasomnia which refers to abnormal behaviors and experiences that occur during sleep, between sleep and wakefulness. So it is characterized by perception of sudden loud noises that seem to originate from within the head. These noises can be startling, often described as explosive or banging sounds, although no actual external sound is present. Now, typically, exploding head syndrome occurs during specific phases of the sleep cycle, primarily when the person is either falling asleep or waking up from sleep. These are transitional states where the brain is shifting between wakefulness and sleep. The exact nature of the noises can, however, vary among individuals, but common descriptions include sounds like an explosion, a gunshot, a loud bang, or maybe a clash of cymbals as well. The experience of this can be quite frightening, leading to a sense of fear or confusion upon awakening. However, despite the dramatic presentation, this is considered a very benign condition. It is not associated with any physical harm, brain damage, or underlying neurological disorder. This is a key aspect which distinguishes it from other sleep related conditions that might have more serious health implications. Moving ahead with the historical background, the term was first coined by Dr. John M.S. Pierce in 1988, although reports of similar experiences can date back to the 19th century, described under different terms. They have been found in the writings of Silas Mitchell, a 19th century American physician, and he noted similar phenomena in soldiers who were recovering from traumatic injuries. One thing is that there's a misconception that the exploding head syndrome is a rare disorder that's not dangerous, and it isn't a sign of a serious health condition. Even though the name sounds like it's serious, it's not as serious, and it isn't underlying cause of any other um, disorder. Moving ahead, experiences of EHS. Hearing a loud noise or explosion when falling asleep or waking up. The sounds can vary widely and they can include door slams, explosion, any loud noise that occurs. It can also be a flash of light or sensation of a sudden shock. Moving ahead, these episodes typically occur during the transition between wakefulness and sleep. The frequency of these episodes can also vary from rare occurrences to multiple episodes in just one night. Most likely, these are to occur during the transitions and when sleeping in a supine position. These are often underdiagnosed and underreported because patients may feel embarrassed about these symptoms. Their prevalence. The exact prevalence of exploding head syndrome is not well documented, but it is believed to be extremely rare. Studies suggest that around 10 to 15% of the entire general population may experience it at least once in their lifetime, though even a smaller subset experiences it frequently. It appears to be more common in women and happens more frequently in individuals who are over the age of 50, although it can affect people of all ages. Moving ahead, Muskan will be taking it forward from here.
Good morning, everyone. Let Before starting to the causes, One thing that needs to be noted is although exploding head syndrome sounds painful, but you really don't feel any pain associated with it. All that the person hears is a loud noise or explosion in the head. Now, let's come to the causes of exploding head syndrome. Scientists are not really sure what causes this, but it's more likely to occur when you're extremely tired or under stress. Now, the possible causes, as per researchers, are stress and anxiety, minor seizures in the temporal lobe of your brain, sudden shifts in the parts of your middle ear, and calcium among the other electrolytes in your body may be the focus in causing nerve cells or neurons that become active. So, in the causes section, it can be, to understand it better, it can be classified into four subparts. First is neurological factors, abnormal neural activity. Second is sleep related triggers. So, irregular sleep patterns or sleep deprivation can cause this. Also, it the head exploding head syndrome occurs in your non-REM sleep stages. Third category would be psychological triggers. So high levels of anxiety and stress play a role, emotional distress or psychological strain. Fourth would be any other contributing factors, for example, use of certain medications or substances. Moving ahead, now, what all symptoms will the person experience if they have exploding head syndrome? It can be divided into four major parts. First is feeling frightened or anxious after the episode, after the loud noise. Second would be experiencing a sudden muscle jerk at the time of the episode. Third would be having difficulty falling back to sleep and waking up sweating, having a rapid heartbeat, or trouble breathing. Some other pointers that also need to be noted, that some people reported seeing flashes of light and feeling muscle twitches along with the noises. It is not common to everyone. Se- uh, the last would be exploding head episodes can occur once or multiple times in a night, but they stop when the person fully wakes up. So again, it only occurs when in the non-REM sleep stage. Next slide. According to International Classification of Sleep Disorders, third edition, the diagnostic criteria would be first recurrent episodes. So there must be a history of recurrent episodes of a sudden loud noise or a sensation of an explosion in the head. Then comes the timing. So during the transition between wakefulness and sleep, this episode is supposed to occur. That's how you diagnose it for the exploding head syndrome. Third would be absence of pain. As mentioned, they are not associated with any significant pain, physical pain we are talking about here. Fourth would be distress or impairment. The episodes cause significant distress or impairment in social, occupational, or other important areas of functioning. Then comes exclusion of other disorders. The symptoms are not better explained by another disorder, such as another type of parasomnia, seizure disorder, or the effects of a substance, for example, a drug or any medication. Last would be absence of organic cause. So, no set cause, no previous cause can explain this sleep disorder. Moving ahead, how can you, coming to the treatment, management, and prevention part, how can you prevent this disorder? So I've divided it into four categories, that is sleep, stress, s- sleep disorders, and anxiety. So if you have about 7 to 9 hours of sleep per night and maintain like good sleep habits, good sleep hygiene, this can be prevented. Stress management. So, relaxation techniques like yoga, deep breathing, meditation can be used in order to prevent this from happening. Consider taking a warm bath before bed or using calming fragrances to allow yourself to not be in a stressful situation and prevent burnout. Third would be address whatever sleep disorder you might be facing. So your provider or your healthcare should know about any existing sleep disorders. So any medications or any device that need to be used should be used. Last would be anxiety management. So if a person is feeling overwhelming anxiety, discuss with your therapist, your psychologist, and they may be able to. Here, I've written the medication that for medication you can go to a psychiatrist, but when it comes to talk therapy, you can refer to your therapist. Next slide. Last would be treatment and management. Here are 6 steps where you can prevent or treat exploding head syndrome. First would be reassurance and education. So, giving appropriate knowledge about what is happening to the patient is really helpful. Second is stress and anxiety management, which we just discussed about. Sleep hygiene, medications if necessary, are addressing underlying conditions if there are any possible causes or possible ways to treat in order to prevent this from happening. And then last comes follow up and monitoring, as it's important because these episodes are very recurrent. Now, uh, in all, for the treatment for exploding head syndrome, we are talking about life modifications, any sort of behavioral therapies or cognitive behavioral therapies to address anxiety and stress management. Then we are talking about pharmacological interventions when we say we can introduce medications maybe to improve sleep or address any other sleep disorders. And last, we're talking about supportive measures when we talk about follow up and monitoring the entire process. With this, we conclude the PPT. We have a few questions for you all. First, what part of the brain is primarily involved in exploding head syndrome? Is it frontal lobe, temporal lobe, or occipital lobe? Okay, I cannot see the messages. Are there any? Yeah, that's right, Kanishka. It's temporal lobe. Second question, exploding head syndrome primarily occurs during which part of the sleep cycle? REM sleep, non-REM, immediately upon waking. That's right. Yes, thank you everyone for answering. It is non-REM, option B. Third question, what is a key non-pharmacological approach to managing exploding head syndrome? Use of sleeping pills, mindful and relaxation exercises, increased caffeine intake. Yes. Thanks everyone for responding. It's mindful and relaxation exercises. With this, we end our today's research presentation. Thank you.